Hello everyone, and warm greetings to all of you. Sorry that we are running a bit late here, 10 minutes. As often it is with technology, do it for the first time. There might be difficulties. Again, apologies, but now we are fully live and we'll get started. My name is Ralph Haller. I'm the founder and president of High-Tech Connect. We are a non-profit organization introducing high-tech trends, applications, business models from all over the world, such as from Silicon Valley, Israel, China, Asia, Europe, Latin America, just name it. So from wherever you can find world-leading technologies and businesses. Last year, we launched an international digital healthcare applications event with a good success. And this year planned the second event on May 11th, so actually for today. This event has now been postponed to the September 21st due to the crisis we all go through. Today, in addition to the originally planned event, we organize a technology against virus initiative, exchanging technology and best practices derived during the corona pandemic so all can share and profit from each other's lessons learned. This is truly international initiative as we have joining people from worldwide. The internet is global after all. We also have an online community as well for discussions and networking, and a great collection of video presentations that keep coming in and it's growing. This digital community platform remains open all the time and can be used whenever it suits you. We hope topics will change, of course, over time away from the current pandemic to other digital health technology topics. Helping me today is Lombard Montevecchi from Northern Italy, who is a healthcare business veteran with more than 25 years international expertise. Welcome, Lombard. Great to have you again.
Thank you very much, Ralph. Hello, and a very warm welcome to everyone out there. I'm Lambert Montevecchi. I'm founder and CEO of Boost Consulting. We are an international change management consulting firm entirely dedicated to the healthcare sector. And for 12 years, we've been in the field, in hospitals, in healthcare organizations around the world, witnessing the challenges they face when deploying and adopting digital technologies. And at the same time, I think like everyone participating to the event here, we're very enthusiastic about the huge performance leap that they can bring to health systems. And we're ready and eager to support the effort. We're truly honored to moderate this international panel discussion dedicated to digital technologies in the fight against COVID-19. Ralph?
Thanks, Lombard. Great pleasure to have you. Before we start, let me briefly explain how you all out there can contribute in this discussion. Thanks to Cisco, Switzerland, and Vbrick, who support us with great solutions and also with engineering services. We can stream this live to hundreds or even thousands simultaneously. So in front of you, you can see on the right 3 buttons. The first button is for polling. We already have asked you some questions for the first poll. Then if you want to ask us questions, there's a Q&A button, the second from the top, and the third one is some additional information on this event. Please join the polls and also ask questions during the event. If you do so, mention the name and whom you want to address it to all of us, or to a specific question. We will select a few of these questions later, but of course we can only answer some of them, and the others will be answered in the community. All the panelists are also in the community. So let's get started. We have experts from 9 countries who will present us with their analysis of how their country coped with the COVID crisis, and in particular how digital technologies were used. We will also be asking them what lessons can be learned from this unprecedented crisis. Before we open up the panel, we could perhaps just kick things off by sharing our own personal experience with the COVID-19. So in my case, I was actually quite lucky. It was a non-event so far. Fortunately, none of my family members had been affected, and I stayed mainly home working from here and wondered a bit what chaos there is elsewhere when following the news. But we decided then very early on, about 3 months ago, to postpone the event to September 21st, in addition to this online initiative focusing on technology against the virus. We think the world first and not one country alone will succeed if we share our experiences and best practices. So how about you, Lombard?
Thank you, Ralph. Well, I'm not here to talk about myself, but for me, unfortunately, things went quite differently. I mean, basically, I caught the virus. I felt quite ill, did not end up in the hospital, but by choosing to stay home, I sadly witnessed the complete breakdown of a very reputable health system, the Italian one. This is the country where I live. By not receiving a single home visit, by being told that an oxygen bottle was useless, by having to find an oximeter by my own means, and basically receiving, no information about what to do except taking paracetamol. So we all know that it's a fact that general practitioners around the world were literally abandoned as hospitals were faced with a tsunami of patients coming in. During the worst moments of the illness, I could not help but think that there must have been, should have been, an easy, simple, modern, readily available digital solution to help and support me, or at least inform me of what I should have been doing. So to come back to the topic of our event today, I'm very, very eager to hear and learn from our distinguished guest panel how their countries have faced this challenge and how digital technologies can facilitate and support world health systems during such a crisis and for the future.
Yeah, thanks, Lambert. Very glad, double glad that you can make it today, and you're on the way back again to your old strengths. Let's get started with Switzerland. We have Dr. Emma Hotgrove. She's researcher at the University of Basel. Emma, how is it in Switzerland, the situation currently?
Sorry, I just wanted to make sure I wasn't muted. In Switzerland, we've been quite lucky the past few weeks. We haven't had to have a very strict lockdown as they've had in many European countries, but we have seen a steady decline in the number of new cases each day, which is looking quite promising. Today, we open up some restaurants and businesses and also schools for the first time, and we'd be very interested to see if we can keep the numbers down with these reopenings.
Thanks. Second would be from Singapore, Karan Sachdeva. He's Director Asia Pacific for IBM Watson and Artificial Intelligence Applications. Hi, Karan. How are things in Singapore?
Hello, good afternoon, everyone, and good morning, everyone. So I'm Karan from Singapore. I had Watson and AI applications, as Elf mentioned. In Singapore, we had faced this earlier as well as SARS epidemic last time. So we were pretty prepared this time. We had government preparing for contact tracing as soon as somebody landed in Singapore who had a contact with the local person who could get this, and we shut down our borders. And then there was a couple of technology initiatives which government launched, like there is an app in which wherever you go you have to take a pass before entering the building. So by that mean government could trace wherever you are going. So it was a good response from the Singapore government. The second part which I want to mention is now there is another wave of infections which is coming because of migrant workers who live in dormitories. They have got it. So now Singapore government is managing that, and they are managing it well.
Okay. Thanks, Karan. The third one would be from Germany, Ralph Gordon Jans. He's the founder of Research to Guidance. Ralph, how are things in Germany currently?
Thank you, Ralph. Hello to everybody. In Germany, we had basically, we started our lockdown, which was supposedly a rather mild lockdown on the 23rd of March. And now from basically last week and today again, Germany is reopening. So that means that shops are being opened. Restaurants partly are being opened. It's more now on a federal state level, where federal states can decide, depending on the number of infections, what to open and what not to open. But Germany is opening up in terms of infection numbers. They came down with all the lockdown measures. And now they are at around 1,000 new infections every day. I mean, let's see how that will develop over the time.
Lambert?
I'm very happy to introduce our three members. So we're going to start with Marjolaine Collet-Vetlet from France. She's Director of Partnerships for Normand E-Santé. And can you tell us, Marjolaine, give us an overview of the situation in France and in Normandy?
Yes, Lambert, thank you for inviting me. I'm very pleased to be there. So in France, I work for NES, as you said, it's a public digital health service companies. In France, we sadly count now more than 26,000 deaths, including less than 10,000 deaths in nursing homes. So in Normandy, my region, that counts 3 million inhabitants, we have been far less affected than the eastern French regions. We count 371 deaths and 530 contaminated cases. The containment in France began on March 17th, and today is the first day of our decontainment, which, like other European countries, will be led by phases. We had to urgently double our availability of ICU beds from 5,000 to 10,000. But now the number of ICU patients is decreasing, so the situation is better in ICU. We also had to transfer patients from east to west region, and we welcome 52 patients from Paris area in Normandy. Some patients from the Alsace region were transferred as far as Marseille in the south. It's 700 kilometers. And even to other neighboring countries. So maybe it is fair to say that we could have been more prepared because our wave arrived later than Italy, maybe 8 or 9 days later.
Thank you very much, Marjolaine. Yes, international and regional cooperation was remarkable. So Claudio, from Italy, what can you tell us about the situation on the Italian front?
Thank you, Lambert, and good morning to everybody. Italy has been the first country in Europe under attack of coronavirus. And we are now at the second week of partially lockdown. Consider that today is not possible traveling from one region to another region, but it's possible to traveling quite free inside a region. As number of cases in Italy, there are about 220,000 total cases of infection, and unfortunately we have 30,000 total deaths. At today, we have about 1,200 new cases by day. Consider that the epidemic outbreak are particularly in 4 regions. The severe situation was in Lombardia, and then there are a medium situation in Veneto, Emilia-Romagna, and Piemonte. And today, for example, the infection is completely under control in other parts of Italy. Consider that the part of southern region of Italy are patient zero free. And so there is only one attention in Lombardia and also in Veneto and Emilia-Romagna. Consider that yesterday we have only 22 new cases in Veneto region. Veneto region is about 5 million inhabitants. So we are looking to go completely outside the lockdown in the next 2 weeks.
Thank you very much, Claudio. I actually forgot to introduce you. You are the IHE Europe Transition Manager and ICT consultant for the Umbria Healthcare Ministry, like France and other countries. Italy as a regional organization, in particular for healthcare, and you're in charge, you're helping them with COVID-19. The next speaker is Dr. Monica Sonu. She's a medical doctor and CEO of Health Innovation Toolbox, and she's joining us from India. So Monica, can you tell us about the situation in India, please?
Thank you very much for the introduction, Dr. Lambert, and a very, very warm greetings to all of you around the world from India. So let's quickly talk about some numbers here. As on 11th May, that's today, our COVID-19 case count stands above 67,000, and while we have more than 2,200 fatalities, last Monday, that's 4th May, our country moved into what is being called lockdown 3.0, and today we are all in the 48th day of world's biggest lockdown. I must say that as a country of 1.3 billion people, India has been extremely, extremely careful in dealing with the COVID-19 right from the beginning. It has taken several proactive measures and, to tackle this pandemic. And in a way, I can say that the government has put in a lot of effort to stay ahead of the curve as the crisis evolved in the country. Right now, I'm sitting in one of the most northeastern states of India, which is like almost 1,600 miles away from the national capital. And I could clearly see that after, more than 5 weeks of a complete ban on the movement of anything but essentials, India is slowly moving back to normality. The most latest updates that are
Monica?
Dr. Lambert. Yeah.
Yes, you're back.
Lambert, can you hear me?
Yes, I can. I think we lost.
Monica, we lost the last sentence, but I think we understood what you're referring to. Thanks a lot. I'd like to introduce now the Netherlands, represented by Elisabeth van der Steenhoven. I hope I pronounced it correctly. She's the chair of Tech Against Corona. How are things in the Netherlands, Elisabeth?
Yes, thank you, Ralph. Today is the first day we're going out of the lockdown. It started on the 12th of March. The numbers of deaths are slowly decreasing. We now count approximately 5,500 of deaths in the Netherlands, though these are the numbers of only of the people who have been tested with COVID-19. The amount of excess death is about 25%. So it seems it's slowly getting better. We are going out of a lockdown, though people are still working at home, and only schools reopened for this. But everybody's extremely careful and wary, since we want to trying to avoid a second wave if possible.
Thanks, Elisabeth. We have next from Portugal, Dr. Micaela Monteiro. She's the Chief Medical Officer for Digital Transformation for the Hospital José de Mayo Zodé, and she has also been involved in the Portuguese telemedicine initiative. Hi, Micaela, how are things in Portugal right now?
Hi, Ralph. Thank you for having me here. Hello, everybody. We had our first case on 2nd of March and went into lockdown on the 16th and into state of emergency. This was in a time where we could already watch our neighbors like Italy and Spain in a very, very difficult situation. I think everybody here was scared, and people were locking down themselves even before the emergency state was declared. Fortunately, so far, health services have been able to cope. There was no breakdown. There were up to now sufficient beds in ITU. We have peaked in the middle of April, and now we are almost overcome the first wave. We are carefully opening since the 2nd of May, but schools and restaurants still keep shut. We have, by yesterday, we had 27,581 confirmed cases and a death toll of 1,135. Yesterday, 12 patients died, unfortunately. Well, this is our situation at the moment. We are apprehensive regarding a possible second wave, but yeah, that's it, how it is.
Thanks, Michaela. And to complete our first round is from Israel, is Professor Dr. Gili Recep Yochav. She's the head infection prevention control of the Sheba Medical Center. Hello, Gili. How are things in Israel?
Hello, you hear me, yeah?
Yes.
Okay, so in Israel, actually, we were, I guess, pretty lucky or prepared enough, I don't know, but currently we have had nearly 16,500 cases altogether. The country is just over 8 million people, the population size. And we have currently active cases of about 4,800. Still 74 serious cases, 64 still ventilated, but obviously we're really going down. The peak, I guess in the peak time, we had about 700 cases per day. That was the highest. Currently, we have approximately 30 cases per day. That's where we are. We had a full lockdown starting from March 19, and we opened about a week ago, and already schools are even beginning to join in very slowly, gradually, but they are joining in. I guess that's probably for the general situation at the moment, and I'll speak a little bit about I think what were the keys for this success. We feel it was obviously a success when looking around the world, and we're hoping that the next wave will maybe only be in the winter, but of course we're getting prepared for anything.
Thanks, Gili. So thanks to all for the first round. Looks like everyone had similar and also diverse situations. And now, of course, we'd like to dive into the real topic of today and our second round. And we'd like to ask all of you to please describe to us what type of digital technologies have been used and how they were deployed in your country. Let's start again with Switzerland. Emma.
Hi, Ralph. Yes, so I'm actually best to speak about the program that I'm a co-developer of, which is nextstrain.org. Some people might already be familiar with this, but if not, I'd recommend checking out at nextstrain.org/ncov. And what we're able to do here is we've been using the viral genetics to track the virus in real time as it's moved around the world. So we first set this up in the middle of January when the first sequences became available. And since then, we've been taking sequences from around the world from many labs who have dedicated themselves to doing this sequencing and then making this data publicly available. And what we do is we look for the tiny changes as the virus accumulates as it replicates and passes on from person to person. And we can use these to see which viruses are more closely related, which ones are more distantly related, and to essentially create what we call a kind of a virus family tree. And because we then know where and when the samples were taken, we can reconstruct with some level of confidence where the virus might have been, when certain events might have happened, how it's transmitted around the world, and to particular outbreaks, for example. One really good example of how this was used was the now slightly famous Seattle cluster, where the Seattle flu study was running to look for incidents of flu in the society. But they had the idea to start testing for coronavirus as well. Now, this was really early in the epidemic where testing was really difficult in the US and the CDC guidelines were quite strict. However, when they looked at these flu samples, they found there was actually coronavirus in the community. What they didn't know was whether these people had just come back perhaps from a high-risk area or whether this is an indication of local transmission, because testing alone, it can be hard to tell this. But using the genetic sequences and using NextStrain, they were able to show that these viruses were really, really similar. And so that, yes, coronavirus was circulating in the greater Seattle area. And of course, this is really important to know when you've made that transition from imported cases to things that are circulating in your area so that you can change public health tactics. And as people start coming out of lockdown, this is also going to be really important because we need to know if cases as they arise are linked in our communities, implying that our social distancing measures might not be as effective as we'd hope, or whether they might be people coming, for example, from other areas, which means our local lockdowns are still working. So we're really excited by the speed that we've been able to accumulate this genetic information, which is totally unprecedented in science. We've never had this many genomes in such a short time period. And we're really excited to the potential and the ability to monitor how things are going in this epidemic into the future.
Great, yeah. Let's dive just for a few seconds into the situation in Switzerland. Actually, today, there was a contact tracing app supposed to be launched, at least the testing. The parliament has stopped this, and it looks like only in summer, or maybe not even, this will be possible. You see this as a big disadvantage, or is there time for introducing this? How do you see this contact tracing app situation in Switzerland? And maybe just to add one comment, this tracing app is actually internationally quite recognized, was developed by the universities and some companies here, and has been used by big internet companies as well. It's a decentralized approach, and it looks like now it cannot come because of legal reasons. How do you see that?
Yeah, so I'm a big advocate for this contact tracing app, and I am a bit disappointed to see that it won't be able to roll out in Switzerland soon. I think the decentralized approach is incredibly important because we need to make sure that we prioritize privacy when we roll out these apps. For one very particular reason, that I think a lot of people will only start the uptake of these apps if they feel like they aren't going to be overly monitored and that these apps won't take advantage of the trust people have shown by downloading them. I think that these apps could be a really powerful tool in our toolkit for trying to make contact tracing quick, so that when people get tested, we can alert everyone who might have been exposed. I do think, however, we need to be careful not to rely too heavily on these apps, because certainly not everyone will download them, and we're still going to have a lot of more traditional contact tracing. But I do think these apps give an easy way for us to easily alert people and identify those contacts. And I think that getting people to use them will be a big advantage to fighting this pandemic.
Thanks, Emma. Moving on to Karan from Singapore. Karan, you are a technology guy, of course, into artificial intelligence. What's the type of digital technologies were used in Singapore and deployed?
You know, one of the basic things which we learned during this pandemic is that information or messaging and communication is key, is very much key. So we in Southeast Asia and in Singapore, we have seen that the spread of fake news, where rumors goes by, and how the disease spreads. Can I go out and visit the supermarket? Can I what kind of testing it takes? How much hours it takes? What are the symptoms? So a lot of rumors are spreading across this when this disease started back in February in Singapore. So this communication is very key. And at IBM, we are happy that we partnered with all the government agencies here in Singapore, as well as the Southeast Asian countries like Indonesia, Malaysia, and I can go up to South Korea and Australia as well, where we make sure that we are implementing a chatbot for a government, where a citizen can come and just put a question in a natural language, in a human friendly language. It could be as simple as that: I am having a fever of 36.5. Does that mean that I have a fever? It could be as basic as that. It could be as advanced as that I am having fever from last 3 days. I have been coughing. My neck is paining, I can feel the bone paining. So are these symptoms of COVID? Are these symptoms of coronavirus? And if yes, where is the nearest testing center where I can go and get myself tested? That is another one. And what are the services or the help government can provide me while this crisis is happening? Okay, will my job be secure? I'm a migrant worker. I work for a construction site. Will my job be secure? Okay, can I remit my funds back to India or to Bangladesh? Okay, those kind of basic questions. These are questions which are very close to human being as well, right? Being a human being. So we have deployed our technology, which we developed as part of natural language, all these chatbot initiatives. That is one. The second, which I think is very key here, is when this coronavirus crisis came into in Singapore, we were in shortage of hand sanitizers or masks. So how can we do supply chain management in real time using AI? Okay, so I want to switch my vendors. I want to, because China has been hit by this, maybe I want to go to Vietnam. Okay, or maybe I want to go to Thailand. How can I do that in real time with real time data? Okay, accessing those data patterns using AI is key. So I would say that AI is nothing more than automation and optimizing the processes. Whatever exists, we just automate and we optimize it so that we can do more with less. That's what we have been doing in Singapore and in other Asian countries.
Great.
Useful.
Yeah, thanks, Karan. Moving on to Germany, Ralph. Germany is certainly also a technology state and country. What has been deployed and used in Germany in terms of technology to fight this crisis?
Yes. So what we did is not only for Germany, but also on a global level, we mapped the digital tools which are being implemented or amended to fight the COVID-19 pandemic along the entire patient cycle. And what we see also for Germany is that at the beginning, new tools are being added quite numerously for information, for education of the patients. Am I being affected or not? So there have been quite a few digital tools, maybe just questionnaire-based or chatbot-based services which have been added by hospitals, by media outlets, by sometimes even government institutions. So there's quite a large offering now on information, education, and also moving into triage systems, helping people to understand whether they should get tested or not. So that's quite a lot of services out there supported by digital tools. Today, when it comes to tracking and tracing, we have a similar discussion as in other European countries. So there's this application which is being built on the PEP standard previously, which favored a centralized approach, and now they changed it to a decentralized approach so that the data is being kept just on the local smartphone. It's also Bluetooth based, allowing the user of the app to get informed whether when somebody they have come close was affected, and then make their own decision of what to do. So that's something which is in discussion, and nobody is really committing to a launch date of this service yet. But some rumors are there that it's going to be launched in June. At least that's the target. But it was already announced right after Easter. So we will see when that actually takes place. Then in the latter phases of digital tools supporting quarantine management, for example, or in hospital management, apart from the things which are there already, there haven't been many new initiatives so far. We would assume that this will take place when the pandemic is more advancing and we are seeing other waves coming in and the number of quarantine patients are jumping up again. One more comment on a government initiative or supported initiative. We have launched in April, we have launched a data donation app, which I think is quite an interesting concept to share here. So what it does, it's for the users who are downloading this application, they provide access to basically 4 kinds of data. They are then donating to the Robert Koch Institute, which is the publisher of this app. So it's basically 2 data points about heart rate. Then we have sleep and we have activity. And the first results they have been able to produce with that was just a map of average heart rates within the regions of Germany the objective of all this is to create a fever map to allow early detection of hotspots of COVID-19. So that's an app, yeah, which has been, I guess, downloaded more than 400,000 times since launch, and it's the first, I would say, government-supported digital initiative to fight this COVID-19. The tracing app, as I mentioned, most likely will come then after June.
Very much, Ralph. So Marjolaine, what can you tell us about the use of digital technologies in France and in your region?
So Lambert, as anywhere in the world, I suppose teleconsultation rocketed. In Normandy, we had 6,000 teleconsultations per year during previous years, and we have now 30,000 per week. Various solutions are used, from private companies to public solutions, such as our solution called Therapy. Therapy is a full web teleconsultation solution, very easy to use for medical doctors and patients, even if they are not digital born. In Normandy, our company, Ness, built a partnership with a private company which provides medical connected devices, and we lent for free those devices to home-based hospitalization devices, pre-professional medical centers, retirement homes, or firemen. All this in order to allow teleconsultation to take place under good condition for the patients who need them the most. Recently, we also set up a remote monitoring system control for COVID plus patients or potential COVID plus patients staying at home under nurses and general practitioners' surveillance. Regarding epidemic control, solutions are not implemented yet in France. It will potentially be an European app, but questions of data privacy and confidentiality are still being debated, and considering the urgency, maybe this delay is an handicap for Europe.
Thank you, Marjolaine. That is a huge boom in medicine, which I guess for you as a public digital health company is a great thing. So thank you, Marjolaine. Claudio, Italia, what can you tell us about the use of technologies?
Yeah, consider one thing. We has been the first country in Europe, so we have completely unprepared to the coronavirus. Consider one thing. One of the best healthcare system in Italy is Lombardia. Probably Lombardia region is one of the best healthcare system in the world. And Lombardia system completely break down. Consider that in the next 2 weeks, we have no time to think what happened. Because consider that, for example, in Veneto region, my region, we completely occupied in 2 weeks the available ICU beds. So we are in completely very terrible situation. So consider in these 2 weeks, all CIO of hospitals have only one thing, one approach, emergency approach, we call war informatics. In this case, you have to focus on the production line that coming from emergency department system to laboratory information system to EMR, in particular intensive care unit system. You have to focus on this for 2 weeks. And then you move to a second step of approach in which you try to collect information, clinical data from COVID patient. That means that you have to increase, for example, form collection in order to have symptoms and so on from the patient. But if you have, for example, an ADT system that is up and running in daily routine, you can extract automatically, for example, the number of available beds in hospital. But if your ADT system is only an administrative system, you have to manually collect this information. Consider that all the information that are collected centrally in Italy, the information that the government show every day during the speech, are collected manually from region and sent using collaborative system like email and spreadsheet to the government. This is the situation of the first 2 weeks. Then we move to taking care the primary care network, because as Lambert said, the mistake that we have made in Italy is that every patient go to the hospital and not is first triaged by the primary network. So we try to connect the general practitioner, nurses, and so on, in order to have this information in real time from the primary care network. Then last, we have tried to avoid the contact between patient and hospitals. That means telemedicine. But consider one thing. If the telemedicine system is currently running, we can use it during this phase. But if your telemedicine system is a project, is used by 2 doctors, but the other 8 doctors of the world don't use this system, it's impossible to deploy a system during epidemic phase. This is our first lesson. We are completely unprepared to this epidemic outbreak because we have no biosurveillance system at national level. So you're talking about artificial intelligence, chatbots, apps. But if you want to talk of this, you need the data. And data you have to collect from hospital. And the collection from hospital today in Italy is partially. We have some hospitals that can be connected to this biosurveillance system without any problem, but we have other hospitals that are very difficult, and we spend 1 or 2 years to connect this laboratory information system to the central system of biosurveillance.
You've given us a very hands-on, factual description of what happened. So thank you very much for that. Dr. Monica, it's good to have you back. You unfortunately broke off when you were telling us about the 1.3 billion people locked down, which is something amazing. In Europe, we're 50, 60, 80 million people, depending on the countries, and we think that's a big lockdown. So I'm sorry you were cut off. But regarding the use of digital technologies in India, what can you tell us?
Well, Dr. Lambert, right from the beginning of this pandemic, India always scouted for the solutions that were more relevant to the country. And one of the earliest measures definitely was public communication. And we used all the possible digital channels, to spread this awareness about the basic do's and don'ts in the COVID-19. We are using, AI for contact tracing. We are using drones for surveillance. We are, using imaging systems, and robotic solutions are being deployed in few hospitals. The concept of telemedicine and remote consultations are picking up in the country. We are using GPS systems. So all in all, these kind of digital tools are helping the local administration here in monitoring the crowd and tracking patients, communicating with the public. So it is at this level. I could just say that these digital technologies are used in a very fragmented way, and we cannot really generalize it for like the whole country. Here, my special mention goes to the Arogya Setu application, which is developed by the Indian Ministry of Electronics and IT. And I must say that world has never seen anything quite like this application before. So if I talk about 2 months ago, India's app for coronavirus contact tracing didn't even existed, okay? And now it has nearly 100 million users. So it is available in 11 different languages. And with a country of 1.3 billion people, this is a good amount of download, and result was it was downloaded in 13 days of its launch, and it became the fastest app ever to reach 50 million downloads. So in a way, we beat Pokemon Go. But the point is, like Dr. Lambert, we definitely cannot celebrate 100 million downloads and sit idle. And there are many interesting and frugal things government has carried out, and we have hugely made use of our mobile and television penetrations too. And the main thing conveyed through these channels were the awareness, and it was all about the right information to even the remotest part of the country. Okay, because all over the India, it's not just the highly tech savvy India. We have the rural India, we have a non-tech savvy India, and we have the last billion who doesn't have access to anything, no mobile phones, no television. So we use the most extreme version of social distancing, and that is the lockdown. And I'm sure this way we made sure that every person in India is aware of coronavirus. We must understand here quickly that Indian healthcare system could never have taken this burden all alone. And in fact, for the matter of fact, the best of the healthcare systems around the world got overwhelmed. Thus, the governmental level policies and initiatives played a gigantic role till date, Dr. Lambert. Yeah, over to you. Thank you.
Thank you, Monica. That's absolutely fascinating, and congratulations on that download. It's remarkable. I'd like to just ask you a question. I mean, the gap between the tech savvy and the people who have downloaded the app and the ones that don't. I mean, how does the Indian government make sure that the information gets out to the population?
That's the point I mentioned, Dr. Lambert. We used, our mobile penetration. We used, the feature phones. We used landlines. We have Corona help desks, and we use television, the national televisions, the viewership of which has, increased to almost 60%, in the latest time, because we are running some of the iconic, TV series which used to run in 80s to glue the nation together, and government very smartly use this time to spread the awareness about the virus during this time. All the awareness campaigns, do's, don'ts, everything is run on the television, and it has penetrated. As I said, I'm not in some cosmopolitan city. I'm not in national capital. I'm sitting 1,600 miles away from the national capital, and I can see right on the ground how people are aware, and everything is going good till date. Yeah.
Thank you so much for that, Monica. Thank you very much. Ralph, I hand it over to you.
Yeah, thanks. Before moving on to Elizabeth from the Netherlands, just a comment for our audience. We started a couple minutes late due to some technical issues here, but now it's all full and running and you're listening here. If you like to participate in the 2 polls, please do so on the right-hand side of your screen. There 2 polls have been launched and can do that. The second button on the right is the possibility for you to actually ask questions to the audience, either to all of them or then mention the person you'd like to ask something, and we collect them and then make them available. So just as a side comment. So moving on to the Netherlands with Elizabeth, what digital technologies have been used and deployed in the Netherlands?
Thank you, Ralph. Well, it's extremely interesting because the Netherlands are a very tech-savvy country. The government is stimulating it. It has, the highest digital connectivity in Europe. And because of this, the government launched a very, very bold and daring initiative. It tried to discuss what track and trace app to use it publicly. I think together with Taiwan, it's the only country, as far as we know, that try to do it in an open source way. The government's Ministry of Health launched, several apps were selected, and launched a appathon in which the entire nation could look into the various apps, discuss its pros and cons through an entire weekend. All the people are interested in tech, but together with doctors, with epidemiologists, with specialists in various areas, together with psychologists and of course coders, looked into all the different possibilities of apps, discussed them publicly, and the result of this huge national discussion is that we collectively realized that none of the apps presented completely suited all our needs, our criteria. And the fact that this was done in such a public way, of course, it was very difficult and there were hiccups, but it led to a deep national debate and understanding of what are the pros and the cons of various apps. And it led to various insights. For instance, we realized collectively that we would like the apps to be open source. we realized what we want and don't want as far as the centralized or decentralized gathering of data, in which we said, well, we want to decentralize. We want it open source. So it did not lead to an app. This will come after a while. But we had a huge discussion as a country, and it heightened our level of understanding and of trust.
Right. So looking at the statistics, Netherlands has been also maybe in some way criticized, if I may say that, for trying an intelligent lockdown, but has paid this with a relatively high fatality rate. Would you think that the technology has helped here or supported your strategy and the measures you have taken?
Yeah, everybody sees the need for tech, obviously, because it's very important to know. We see regional differences. It's very important to know who has been infected and who hasn't. So most definitely, Ralph, there is a need for tech, but we do need this in a smart way. And for instance, this very open approach has some very interesting results. For one, the fact that it was a very open hackathon led to the fact that coders from the entire Netherlands jumped into the codes of the various apps. And on day 2, a flaw was discovered in one of the apps. That's one result. The second result is that because of this very open process, there is now, which might seem paradoxically, more trust because it's been discussed publicly. We also saw the ups and downs. You are right, Ralph. There is a big discussion about what to do and whether the lockdown should be more intense or not. So there's a clear need for tech, and it's very smart to discuss this as the entire country did. The result now is that there are several apps which are being used on voluntary based, and people are filling in all their data. They're developed by hospitals, so there's a big amount of trust. And the apps which will now be developed are being developed very carefully together with, based on the needs of doctors in a very open and transparent process. So the effect of that will be is that a higher amount of people and a higher amount of population will indeed be installing these apps and using that because of this process. So Ralph, yes, it was a roller coaster for all of us in the Netherlands, but it was a very good one because this very open process, just like in Taiwan or close to what happened in Taiwan, increased the level of awareness in the country. And it actually matches the Netherlands very well because it's a very tech-savvy country. The government is doing a lot to support tech and to invite tech from other countries. And one last thing, Ralph, is that what's interesting is that there is a huge public-private cooperation. Tech entrepreneurs gathered in all sorts of networks, Tech Leap, Tech Against Corona, etc., trying to help the government. And from the other side, the government is very, very, very actively supporting tech and inviting tech. So yes, we're very much focused also on tech as a way to fight COVID-19.
Okay, thanks, Elizabeth. Moving on to Micaela from Portugal. You have been personally heavily involved in telemedicine. I suppose this has been used now among other technologies in Portugal, correct?
Yeah, that's true. But first, let me. I think we can look at what we have done on a public health crisis management view perspective, and then on a more individual care perspective, where obviously telemedicine and video consultation is of huge importance and has had a very fast development. But let me first share a little bit with you what has happened on the public health on a macro management perspective. So first of all, we are a 10 million inhabitants country, so not as India, for instance, with this huge population, and we have a rather centralized health system, which is a national health system, which cohabits with a private health system, but every citizen is part of this national health system, may also consume private care, of course. So first of all, there is, and this is important when you manage public health crisis and then public health crisis of this dimension. There is a digital NHS registry where every citizen has a unique identification number and a responsible primary care physician, which is, you will see why this is so important. Then there was already in place a central platform for notifiable disease, which is mandatory for doctors and for laboratories, and which has been used in the past in other situations of public health, of communicable public health threats. And then there is another mandatory digital platform for death certification. So this enables the system to have almost real-time information. So where diagnosis of COVID patients were done, and also not only the amount, but also geographically where the focuses have arisen. And of course, it also gave us a very accurate idea of who's dying in our country and from what diseases, and if there is excess mortality, for instance, from other diseases. And on top of that, very soon after the problem came up, there was another digital platform developed and deployed. This, yes, specifically for fighting coronavirus, this coronavirus pandemic. It's called TraceCovid. So it is a platform that enables the primary care physicians to do the mandatory follow-up of the confirmed cases. So it is fed by the information of this notifiable disease platform. It gets information from the mandatory e-death certification platform, and of course, all the Portuguese citizens are within this platform through this digital registry. So whenever there is a diagnosis of COVID in our country, the caring primary healthcare physician will know that and will be able to make the follow-up of the patient through this platform. There are even score risks that risk scores, sorry, that help the primary care to prioritize work in the morning when the physician opens the platform. And on the other hand, the central the Ministry of Health really can assure that people are tracked and that people who are ill receive their follow-up. And soon patients will be able even to self-report via the already existing Citizens Health Portal, where every citizen has access to his or her EHR, at least partially. So it is an ecosystem that helps to tackle this crisis and to keep follow-up of this crisis. On a more individual care perspective, of course, video consultation is a very, very precious tool, not only for COVID patients, but for all those chronic disease patients that are at high risk within this crisis. And if we don't take care of them, then mortality, then this excess mortality will even may even become a more important problem than the very COVID lethality. So video consultations, they came up in the public and so in the public health system, where at this point patients can do video consultations through the citizen portal with their primary healthcare physician. This was already prepared before COVID crisis, and now obviously deployment has been accelerated so that this is possible since, I think, last week. But also in the private sector, things ran really fast. So I'm working at José Mel Saúde, which is the biggest, the largest private healthcare provider in Portugal. We have 20 healthcare units, 2.6 million appointments every year. And we were studying the possibility of video consultations before COVID, and now we set up within a week a solution. And at this moment, we do about 800 teleconsultations a day. So this was really a fast run, and it was quite a success. And one of the aspects of this success is obviously that old barriers which were in the head of I'm a doctor, so I'm a physician, but of many physicians and also of hospital administrators regarding remote caring were obviously not existent anymore. Everybody was eager to get a remote channel to interact with their patients. So.
Yeah, thanks, Michaela. Moving on to Israel, Chile. I'm sure Israel has used all its high-tech knowledge here, and tell us about it, Judith.
Yes. Yes. Yeah, I have to say first, probably that what were the keys? We were still thinking of what were the keys for the success, and again, only 250 people dead in a country of over 8 million people. We're thinking, what is it, and what were the keys for the success? I think one major key for success was preparedness. And in that, I think some digital technologies had a role, and I'll mention in a minute. But I have to still emphasize on the fact that probably what did contain the pandemic was the early closure of the borders, which was very early in Israel, initially only to the Far East, China, and then the rest of the Far East. Italy was a little bit later, and also that the full lockdown, and it was really a full lockdown starting from March 19, was probably also very early and very intensive. There was a lot of course, debate on that, but I think that did manage in many ways the big wave that could have been here. But regarding the preparedness and the digital technologies, one major thing we understood was that in order to be prepared, one of the major goals is really protecting the healthcare workers and letting them feel secure. And for that, this is something I would say against the DNA of the physicians, and I agree with a lot of things that Michaela has mentioned, and I think we had very similar experience in this. It's against our DNA to not touch the patient, to not feel him, and it was difficult to get the ideas of telemedicine to some of the physicians, but very fast we understood that this has a major role. Explaining the physicians that you have to minimize exposure, you have to minimize physical contact, and we had good tools. We had just the telemedicine. We used the Unipair system, which is in many ways like the Zoom. That is good for the milder cases. We had the TytoCare, where we can actually, I don't know if anybody else has been using this. I see Michaela has. Yeah, very comfortable for use, and really gives a lot of information. You feel that you're really close to the patient. That was very helpful. We also used in the ICU, where these kind of technologies won't help that much. We used a telepresence robot, which was very helpful. In addition, of course, to a nurse that was in the ICU, but this robot could really come near, could see the monitors, and very, very helpful. So I think that was one definitely important tools that we were using. Other things that we have been using is, again, the issue of contact tracing. The government does have an app. The compliance with it is, again, dependent on how much people, because it is very centralized, and so there is a lot of debate about, the privacy, and so I don't know the numbers of how many have been using this. It's interesting to look for. But one other thing that we have been using in the hospital to detect, who do we have to isolate after they were in contact, is a new technology. It's called AnyVision, an AnyVision system, which uses facial recognition identification. And what we're doing is a lot of these investigations of, there was a positive patient diagnosed eventually, and we start tracing who was in contact, which one of the healthcare workers was in contact, what kind of contact it was. And many will say, well, I don't remember this other healthcare worker. Maybe I ate with him, maybe I didn't. I think I was with a mask, maybe I was not. And we're using this, and of course, only very specific areas, mainly in the ER, but not only. And many people who don't remember, we can just look at the system recognizes their faces, and we can see, oh, there they are without a mask, without they're eating together, whatever, and that was very, very helpful. Some other things that we are just going into right now is how to detect COVID suspected patients. We're trying currently several temperature screening methods. While again, we know that the main issue is, of course, or a big issue, I don't know if the main, but a big issue is detecting the asymptomatic patients. And of course, these systems will not help there. One other thing where innovative technology we're currently trying is, it's called NanoSense. It's based on scent, or the volatile organic compounds that a person exhales. And the idea is that this will be a very sensitive method to detect probably any respiratory virus or respiratory infection. It will probably not be very specific, but still, if we can recognize those patients who may have something and say, okay, if you're entering the hospital, or maybe don't enter the supermarket, etc., because the idea is that it's very fast. Within 30 seconds, you can identify a patient who is positive for any kind of respiratory infection. And the system, so it's using both the volatile organic compounds and AI learning actually what kind of smells do people with COVID or other respiratory infections. I think that's probably the major things that we have been using technology-wise, yeah.
Okay, thanks a lot, Chili. We got now many questions, so it helped that I was calling for that, and we have selected a few of them. One of them is was actually related to Netherlands, but it's the exact same topic for Israel. So before I will ask and hand over to Elizabeth, I think the same one applies to Israel. With regards to have been for the apps that you have been using, or in the Netherlands, the Appathon. In Israel, have there been laws in place already, or have you had to bring this in front of the parliament? And how was this good or bad in Israel? And then after that, Elizabeth for the Netherlands.
Yeah, I think there was, it was just by law. It was not anything that was out for the public, very in contrast to what was happening in the Netherlands. And I think that brought up a lot of debate. So again, some people did join in. I'm not sure about the numbers of how many, definitely a large percentage. It's not negligible, but it's not all of the population using this. And again, I'm not sure how helpful that was in the contact tracing. I don't know. But it was just by law, and nothing went up even to the parliament, and obviously not to the public.
Right. Elizabeth, how was the legal situation for this app, or appathon, what you call it, in the Netherlands?
Yes, it's a very good question indeed, and there has been debates whether it should go through Parliament, and it was actually the Parliament that said that they would like to look into what kind of app is needed, and exactly these issue also raised by Ralph from Germany about privacy, about data ownership, and the kind of new tech solutions, because it's probably not going to be one app which is going to come out, but several digital solutions, apps, which will be used simultaneously. So not necessarily one for tracking and tracing combined, for all the reasons everybody went through. And yes, it's certainly going to go through Parliament. That is a general impression, because it also raised a very big debate in the Netherlands.
Okay, yeah. There's one question from Germany. Ralph, someone was asking if there has been, what were the reasons for the relative success of the German COVID crisis compared to other countries, very relatively low mortality rate. Can you dive into this a little bit?
Yeah, obviously, the answer depends on who you ask, and everybody has got his own opinion about that. But I think one part of the answer is obviously the number of beds being made available within a short period of time, and obviously Germany was, in a sense, a bit lucky, yeah, that they had this pre-warning phase of a few weeks from this pandemic outbreak in Italy and in other areas. So they had some weeks here to prepare. I guess that's part of the answer. And then, yeah, others would also add, yeah, that people are just behaving sensitively, yeah, and taking precautions, yeah, on a large scale.
Good. Thanks, Ralph. So we're coming to the third round. And like to ask everyone, and try to be brief, since we're already more than an hour into the discussion now. How effective have these measures and deployments been? You already, I think, hinted on some of them, but specifically now, what has worked, what has not worked? And maybe from my side, would you give your country, as Bill Gates was mentioning it, an A grade, B, or not so good? So let's start backwards this time with Geely. And Geely, how you rate success or not of Israel? I think you're quite happy with how it worked.
Yeah. I probably, as I said, at least the technologies I mentioned that are already in use, not yet the ones that we're trying, we'll have to see with those, but definitely a big success. I think the telemedicine, I feel in that very similar to what Michaela has said, really advanced several grades up, and will definitely be used further. I think for home hospitalization, for home visits, oncology patients who may be very afraid to come to the hospital. Currently, it's being used, and I'm sure it will, continue within the coming years. It's not just, for the COVID, it's in general. And I think, the interesting thing is that we saw that even with this telemedicine and distance, we actually can produce intimacy, which is very interesting. Psychologists, psychiatrists have been using it. So, I think that was probably the major, really the major advance. And
Right, thanks. Michaela in Portugal, please try to be brief. Thanks.
Yep, thank you. Yes, so I would give it an A or A minus maybe. We were able to build on already a quite solid suite of tools, and this makes it obviously easier. You don't have to start from zero.
Elizabeth, again, in the Netherlands, you're happy with how things worked?
Yes, I think this the fact that the Appathon was so open and public, it had its flaws, this process, but I think it was very good to do it in such a open way. And the apps which are being used now, which are on a voluntary base, they are working. When people fill in and clearly there is something wrong, they're being called back immediately. Several people through these apps have been called back immediately, have been redirected to hospital. So yeah, they are working.
Okay.
Thank you, Elizabeth. Dr. Monica?
Yeah.
Early at this stage to measure the effectiveness, you're on the ground, what can you tell us?
Yeah, thank you so much, Dr. Lambert. I must say that India is reporting continuously new cases, and lockdown may not have flattened the COVID-19 curve, but it has definitely, bought India time as it, approaches the infection peak. And lockdown seems to be a successful strategy till date, as it slowed down the growth in the number of cases, coupled with the low mortality rate which we are seeing in the country. The best part about it is that it gave India a breathing space and time to ramp up its, the infrastructure, the medical facilities, quickly increasing up some capacity, spread awareness. So, all these things are going on in this period of lockdown. Provided if we haven't gone for such kind of measures, okay, by last month only, we would have reported some 8.2 lakh COVID cases, which could have been a complete disaster, not only for India, but for entire world, I guess. Now, the challenge for the country would be keep up to the rate of growth of infection and mortality rate in check for next few weeks. And the $1,000,000 question which will be coming to us is, and everybody is desperate to know, is when it's it's the peak. When is India reaching its peak? So early prediction has estimated that COVID-19 peak to hit India by mid-May, but as per the revised calculations, it's sometime we are seeing it sometime between June to July. Courtesy extended lockdown in the country. Over to you. Thank you.
Thank you, Dr. Monica. Claudio, Italy is one of the countries that was hit worse. And what could you tell us, even if it's early, about the expected effectiveness of some of the digital solutions that are being deployed?
Yeah, two examples. The first is coming from Lombardia region, in which they have deployed a very interesting contact tracing app. And there is about 2 million people that have downloaded and used the app, that represent the 20% of population of Lombardy. But at today, there are no good results of supporting the control of epidemic disease. So it seems that apps are more than popular for politicians to talk in than more useful in the real life epidemic outbreak. On the other hand, we have the approach of Veneto region that is completely different, no apps, but it constitutes a big data approach in which they put together information that are coming from clinical system, from demographic information. The family is the nucleus of epidemic disease, the information from labor, in which way all the people are working, and information of school, in order to have the idea what will happen when school open. And of course, very important for the environment data, because it's clear that the epidemic moved from Lombardy and Veneto, that are two of the regions with more pollution, during February, that is the worst month in the year for pollution. And so we have only to cross information from epidemics. This is very important. And results of Veneto region, the epidemic disease is completely under control, with partially different lockdown and opening from the lockdown. So different strategy, one is successful, the apps strategy seems not so promising.
Thank you very much, Claudio, for these insights. Marjolaine, what can you tell us about the effectiveness of some of the things you deployed? You mentioned telemedicine. Are there other apps on their way? And what is your assessment of how the region has performed?
Well, concerning telemedicine, We don't know yet about its efficiency. We only know that it allows everybody to access medical care without moving and avoid potential contamination situations. We have excellent feedbacks from healthcare professionals using our solution therapy, and we are happy to contribute to facilitate their work. However, we can say that territorial and social inequalities are more acute when you have no digital access, no Wi-Fi, no 4G, or no smartphones or computers. For precarious population, it is difficult to have access to teleconsultation. And even if telemedicine is definitely more used during this very difficult time, healthcare demands severely decreased because of fear of COVID, because of fear of bothering medical doctors, and doctors fears delays in diagnosis and appropriate care for other diseases. I think this is a general problem around the world.
I think Normandy has done quite well compared to other regions, don't you think?
Yes, yes. You know, during this crisis, we saw that regional level was indeed a good level. It permits reactivity within healthcare professional community, and also, you know, healthcare level was able to buy some masks and other necessary materials during COVID-19. We saw that, you know, our company NES, was a public digital health service companies, success in its use of telemedicine solutions. Also because we have a great team, technical support team who is very quite available for professional questions.
Congratulations. Thank you very much, Marjolaine. Ralph, over to you.
Yeah, and I hand over to the other Ralph. Germany, how happy are you with the end result, so to speak? Or was it worked? Was it not worked?
Yeah, I mean, maybe it's a bit too early, yeah, to have a final results on the digital. How do digital tools support or not support this pandemic? Most of them in the information area and triage thing, I think we can constitute that obviously they have informed, they have kept and filtered people out from not going to do the tests because it was not needed. Yeah, so they took a bit of traffic from those testing stations away. I think that's definitely a plus, which one can already constitute today. In terms of this data donation app, it's too early to see results from that, which could have an impact here on steering resources to those areas where there see infection areas. That's a bit too early, but I think the assumption is that it will be of help. Tracing app is not in place. Then telehealth, I think that's something which it's more a cultural shift, which we see midterm. And that was already mentioned from a few of our speakers here. Yeah, it's more, we see that doctors are now making use of it. Technology was there already before. And during the pandemic, they got a bit of a push here to make use of it and see how that works. And we see that this will be the long-lasting impact this pandemic has, that telehealth solution and remote monitoring are being more used widely in the German healthcare system. And our first results in this regard, they really tend, I mean, in the same direction. So usage and number of visits, they got up, even so from a very, very low base. But people start making use of that, and that's maybe the biggest change, long-lasting change we will see from digital tools being used in this pandemic time.
Thanks, Ralph. Karan, how is it in Singapore? You're totally happy with the the results? Has everything worked? And if so, why? And if not, why not?
Yeah, Ralph. I won't say that it's 100% everyone is happy, but the government has done a great job in providing accurate information to citizens, so that safe distance measures and restaurants and bars could operate, like takeaway are still allowed. So because Singapore has a habit of not cooking in home, so those kind of measures government has taken, so that the economy and the people are least impacted. But government could have done more in terms of guarding the migrant workers, where the virus has now come in. But one thing is good, that these migrant workers are very young, so now government is providing them a good treatment, taking care of them. They have built hospitals exclusively for them, so that way it is turning up good. Now the information providing and the mass scale testing will be key, which they have been doing greatly. And now we are also government is also partnering with industries like pharmas and retailers to provide these facilities free of cost to these migrant workers. So that's also key. So I'm hopeful that everything will turn up positively at the end of the day, when we are over the crisis.
Right. Thanks. Emma, back to you. Would you give Switzerland an A grade, or how you happy are you with the things taken there?
So I'll resist grading Switzerland, but I do think one thing that's really important to keep in mind is that we haven't all had the same experience, even within a country, of the epidemic, and I think this is really important. So in Switzerland, for example, we've had more cases in the south, in the French-speaking region, than in the north, and this has led to quite different perceptions of how successful we've been. I've heard from people in the south that some of them feel like, why didn't we take some action earlier, and are we moving too soon to reopen? Whereas particularly many places in the German-speaking regions who haven't been very well affected might be thinking that we've overreacted. And I think this is something that's really hard to navigate for countries, governments, and just for society, to try and reconcile these very different experiences that we've had. I think in Switzerland, we were fairly hard hit, but we did take action in time to stop the epidemic from becoming really widespread. I think possibly as much luck as good planning, because we didn't know at the time how many cases we had. And luckily, when we went into the partial lockdown, we didn't have so many that this seemed to struggle to be effective. It's been very effective, and we've been able to get those case numbers down. But I do think we need to be really cautious as we start opening up, particularly because I don't think there's anything intrinsically special. That's why, for example, the German-speaking region wasn't hit so hard, except for that we had fewer introductions and they happened later. And so we were able to contain the epidemic quite well. So we need to be cautious as we move forward, that we aren't overconfident in our ability to contain the virus, and that we stay really vigilant and continue to roll out, for example, testing and tracing here in Switzerland, which hasn't rolled out at the level that it has in some other countries, to make sure that we don't fall victim to the virus a second time.
Okay. Well, we're coming to the final round. I think you nearly did exactly what I was asking the final round, to lessons learned and takeaways, and what you would like to share with others. There is one question also coming from the audience. Maybe in our final round, each of you can give their personal estimate. I know you're not experts in the field, but there was the question, how long you feel it will take for a vaccine to be available? Just your personal opinion. Obviously, you have a medical background and can look at this from your point of view. So Emma, your last round conclusions, takeaways. What would you like to share with us and the audience out there? And what's your estimate for a vaccine available or not?
Yeah, so sorry, I think I did jump the gun a little bit, perhaps with my previous answer, but I think that it's possibly a good introduction to this. I do think another thing that we need to be really aware of as we try and guide the public and guide communities through the next few months is that I think that there's a good chance that our progress is going to be a little bit back and forth. I think we've seen this even in South Korea, where they've done a really, really good job at managing the virus. They've had outbreaks, they've had to sometimes take a few steps back in their lockdowns or in their kind of strictness of what's open. And I think that we should be clear communicating to the public that that's a possibility in every country going forward. That doesn't mean that we failed. It means that we're being vigilant enough to catch this early, hopefully, and to take steps to make sure it doesn't proceed. And this is really important because I do think a vaccine is on the horizon. But that means that we have to find a way to live with this virus and reopen the economy as much as possible and as much as safe as possible until that vaccine arrives. I am not an expert in vaccine technology at all, but I do think it's really incredible how well scientists and medical professionals and technology professionals are working together so well through this whole epidemic. There is no request I've made of anyone online, any scientist or researcher, that hasn't been met with, we will find a way to do this. And I really believe we have some great teams around the world working on vaccines, and I think we will be successful. But whether that will be in 10 months or whether that will be in 18 months, I think we just don't know until we have more information about how effective these vaccines are. And we also have to keep in mind that even when we develop one, we have to then manufacture that for billions of people and then distribute it. And that's not going to happen overnight either. So we need to make sure that we don't sell this a little bit too hard, that this is something that even when it becomes available, it's not going to be available to everyone the next day. So we need to be in for a bit of a long-term run here as far as managing this virus until we can get a vaccine to everyone who needs it.
Thanks, Emma. Ralph, your closing comments and prediction for vaccine available or not? By when?
I mean, I wouldn't like to add some other comments on the vaccine side here, but maybe give some hope, at least for the digital health industry. We did a global survey on various things, and we asked the healthcare industry which industry segment will be impacted the most of this pandemic, and digital health solution vendors, they largely see a more positive future for their services as compared to others. So if you are in the digital health industry, that's maybe there's some light at the end of the tunnel. At least that's what your colleagues also from the global healthcare industry are seeing here. Will it last? The positive impact on the digital health industry, 67% say yes, it will last. So this pandemic will change the way digital health is being treated, not only for telehealth, but also for other segments of the industry.
Right. Lambert?
Yes. Marjolaine, you were saying before that your organization has significantly boosted its activity, and even if it's, what are the conclusions or the lessons learned for you and your organization?
Well, for NES, unlike private companies, we prioritize local care and wish to preserve public and private healthcare links. This proximity has a main advantage for patients and doctors because they're all connected through therapy. So, I really think regional level work very much than national level in France. And I think, and I know because I talked to a lot of doctor or medical doctors who use now, teleconsultation solution, that will continue to use it. And I think it's a first step to other, digital solution to be used in France. But, it's a really big change in France because we are not so connected, I think, in healthcare, departments. We are very connected in other industries, but in healthcare industry, it's not like that. But now we are going, I think, healthcare community is going to use more and more digital as solution.
Thank you, Marjolaine. A bit like the peak of the COVID, are you expecting telemedicine to drop again the coming weeks and months?
Well, yes, I think as Emma said, it will be back and forth. We will see what the end of lockdown will mean, and then if we had to get back at the lockdown, because we don't really know if we saw yesterday. I saw on the news that there were some COVID-19 clusters that were emerging in other regions. So we are careful. Everybody in France is careful, but I think unlike that, in Germany we are less good at keeping everything very straight in social distancing. But we're trying. So I think we're gonna succeed because we hope everybody is gonna be okay. So I'm just going to wait and see.
Thank you so much, Marjolaine. Claudio, what is your point of view from Italy?
I think that we have one lesson learned. The first is this lesson is reaction speed. We spend 2 weeks to react to the epidemic. And this is the reason that we have a very strong lockdown in Italy. And we cannot make another lockdown in Italy because if we make another lockdown, the problem is not the infection, but the problem is the economic situation that is worse than infection probably. And so we have to avoid the next lockdown. To do this is quite impossible to have an immunization campaign in next autumn. We are in May now and there is no vaccine and it's impossible. So we have to work to reduce the possibility to another infection. And to do this, we need to read the sentinel events from the territory. It's very important. And to do this, we need 2 things. First, to avoid to have the 40% of population that are false positive because they have a flu during the next autumn. So we have to have a disclaimer. What is the flu, the normal flu, and what is the COVID? And this is one example. The other one is that we have to make some very local lockdown. We have to lock down a building, not a city, in order to reduce the economical approaches. So I think that we need the biosurveillance system, a system that take on board all the citizens. The approach for me is not to give a tracing app. We need that every citizen come on board. It's like a customer relation management system. We need to take on board every citizen to help him for better type of life to avoid another epidemic phase.
Claudio. Dr. Monica, what are the takeaways for India and what's next?
Dr. Lambert, definitely the biggest takeaway for India here is, we need to understand as a country, it need to be prepared that what's next is coming for India and where it wants to position its healthcare sector in terms of government spending and priority. We need to gear up in formulating a robust, primary healthcare network across the country to deal with such kind of situation either today or in coming future. However, I must say that it's just the beginning and India might see several rounds of suppresses and lift cycles. And the immediate challenge for India is to ensure that, the rural India is not hit. So testing, quarantine, treatment, focus on spots, not broad lockdowns are something we can take from here as we really can't shut a $2.9 trillion worth of economy every day. Yeah, over to you.
Thank you very much, Monica. Thank you. Ralph?
Sure. Elizabeth, your final comments.
Well, maybe about the question about the vaccine. I am not a virologist, nor am I a doctor, so I'll absolutely restrain from any comment on that. What I would like to plea for, however, is to continue focusing on the public-private partnerships. I think also points mentioned by Karan Sachdeva in his work. They're now more needed than ever. This initiative, which was taken by Public Matters, a government relationship here in the Netherlands, to have this huge alliance for tech, trying to support the governments in the fight against COVID-19 or the control over COVID-19. There are countless other similar initiatives also in the Netherlands. And I think especially now a very open dialogue between the government, the health sector and tech about all these uncertainties which all of us are facing is extremely fruitful. Thank you, Ralph, and thank you for this dialogue initiated by High Tech Connect, because the international spreading of ideas is crucial.
Thank you. Michaela?
Well, just coming back to the digital part, what I think one of the lessons learned and the takeaways for the future is what Karen from Israel said, to be prepared. And what does it mean when a country, those countries that in the past have looked at digital health and its technological solutions from a system perspective, in the public and in the private system, they don't have built silo solutions and closed solutions. I think they will always be better prepared to manage a crisis like this. And any digital solution against COVID-19 will be much more effective if it connects it to the rest of the system. And I think the colleague from Italy said he does not believe in all those app solutions. And all those app solutions, they have really, their weak point is that they are isolated within all this crisis, and this is why they are not effective at all. Thank you.
Yeah, thank you. We did not lose Singapore or Israel, but yeah, they couldn't just stay longer. In particular, Israel, she's in the hospital, and she's of course still in the middle of it. And Singapore is also quite late now. It's reaching, I think, midnight. So we're going to wrap up things now finally. And Lombard, you want to start?
So we really sincerely want to thank the audience for the participation, and also, of course, our speakers for sharing all these insights and their personal analysis of the situation in their countries. I guess in about less than 2 hours, we really learned a lot, which is the purpose of this type of event. But there are lots of other opportunities to continue engaging with us. So I will let Ralph explain that. We can wrap up.
Yeah, thanks to all people here, panelists, and of course the audience out there. We indeed have many more things offered. We have an online community. All the panelists are in there. Some of the questions we just couldn't ask, we will drop them in the community. There will be video recordings made available. They're actually already available, and there can be new ones submitted as well. So pre-recorded video presentations showing technology that's applicable. Thanks again to all of you, the attendees worldwide, and we also have this afternoon at 4 p.m. Another panel discussion, also with quite international group of people, then moderated by Professor Dr. Alfred Anger from the ZHAW here in close to Zurich. And lastly, if you still want to register for the digital, hopefully physical digital healthcare event in September 21st, we expect it to be physical or maybe both online and physical. We'll see. Then you can do so, of course. And yeah, thanks again, and stay safe. And thanks for sharing the lessons that you have all learned. Bye-bye.
Bye-bye.